So we're going to move on now a little bit backwards towards advocacy. And we're going to be joined by two speakers that pretty much don't really need an introduction. That's Dr. Sonia Akrimi and Dr. Emma Coley, but I'm going to tell you about them anyway, because there are so many other strings to their bow than the ones that you've already seen today. So Sonia, first of all, is the current director of ZADP and also a trustee and lead for funding for GADP. She sits on the World Federation, the WFSA Education Committee, and also the International Relations Committee of the Association of Anaesthetists. She's one of the programme leads for Inspire through Clinical Teaching course and the Overseas Healthcare Leadership Programme. Clinically, other than all of that, her day job is that she's a senior registrar in anaesthesia in the UK. Sonia's passionate about medical education and how we can use international partnerships and medical education training to develop safe, quality surgical care in LMICs. She's currently completing a PhD in medical education, researching new ways anaesthetists can contribute to undergraduate training, and teaches on the MA in clinical education at King's College London. And Dr. Emma Coley is a military anaesthetic consultant specialising in cardiothoracic anaesthesia, working in Edinburgh in Scotland, just down the road from me. She's a trustee and secretary for GADP and part of the ZADP committee. Emma took part in ZADP as a senior trainee in 2015, spending 6 months working at UTH in Lusaka. She also represents GADP and the military on the Global Partnerships Committee at the Royal College of Anaesthetists, and Maria and David from the Global Partnerships Committee are kindly supporting the conference today, so thank you so much to them. Emma's an educational supervisor and a military deputy regional advisor, and in her military role, she's introduced military trainees into ZADP as well. So I'm going to pass over to Sonia and Emma to talk to us about advocacy within GADP.
Hello. We are here to talk about advocacy within our charity, Global Anaesthesia Development Partnerships. Both Emma and I are trustees of GADP, and we sit on the committee of our Zambian partnership, the Zambia Anaesthesia Development Programme. Advocacy has been one of our activities in ZADP and also the GADP charity for many years. We've focused on advocating for the need for safe surgery, safe anaesthesia, and also increasing capacity for critical care across low and middle income countries. During the pandemic, however, a number of new issues have really come to the forefront of our work that we've focused on through advocacy and campaigning.
So looking into these different advocacy issues, starting with the role of health partnerships in a global pandemic, we have had to look at how we can have an ongoing review of our activities and work out how to support in-country learning and development without actually being able to travel. So this is in things like the development of our remote fellowship, and you've heard about that from Rebecca, Maria, and Hannah, and also continuing to develop those relationships, whether that be through that remote fellowship or through working with other organisations, learning from each other with joint teaching methods like the WFSA, or developing things like the mortality and morbidity meetings, which have now become multidisciplinary rather than just one specialty. And that is just an ongoing representation of how well health partnerships during the global pandemic can still be developed, despite this inability to have face-to-face organisational input. Also, leading on from that, as anaesthetists and other medical specialists, we understand how important it is that oxygen is available for management of patients with COVID-19 and respiratory failure. And only in April 2021, the Zambian Biomedical Equipment Survey report was released, and that was supported and funded by the Gates Foundation and supported by the Ministry of Health and Anaesthesia and Critical Care departments. And this looked at how within 8 of the institutions, they found that all the institutions needed urgent procurement of medical equipment for oxygen delivery, monitoring devices, and also accompanying consumables. They found that there were insufficient staff trained to adequately manage COVID-19 patients. And when they set up a surge scenario where 100% of the COVID-19 allocated beds were occupied, they found that there would be an oxygen gap of approximately 3,600 litres per minute. Now, that in the context of cost is actually $3,464 million. And that only covers the procurement and operation for 6 months to fill this gap. And within that, I talked about how it's important to be able to monitor that oxygen delivery as well. And that requires pulse oximetry, which are really limited in this environment. And the gap to cover the cost of those devices was approximately $261,000. And that in itself is a massive difference and a real problem within this type of environment during a pandemic.
Vaccine inequity has also been a huge issue to affect our partnership and global pandemic management. Vaccine availability came much later in our partner countries, Zambia and Ethiopia, in comparison to high-income countries. In this week that we're recording this presentation, we have celebrated the 1 billionth COVAX vaccine dose being delivered to a low middle-income country. Currently, 3.4 billion people, however, still have not yet had their first dose of a COVID-19 vaccine. And when you think that there are only 7.7 billion people globally, this represents half of the global population not yet to have received a dose. This predominantly affects low and low middle income countries. Approximately 8% of populations in low income countries only so far have not yet received a first dose of COVID-19 vaccine. This data here is taken from the Zambia Ministry of Health, who release vaccination data and COVID data weekly. In this last week, they have informed us that 1.6 million people have been vaccinated fully against COVID-19 in Zambia. Although that's a fantastic number, this has to be considered in relation to the population being 18.38 million. And that means that even up until now, only 8.9% of the Zambian population are fully vaccinated against COVID-19. And this corroborates the fact that Gavi and other organisations have told us that in lower middle income countries, vaccination rates still remain critically low. And we really must work towards vaccine inequity being abolished and global vaccination being available for everyone to be able to manage this pandemic going forwards. Loss of UK aid funding is also a significant issue that has affected global development work in the last year. This affected our organisation personally as well. In the last year, we have seen the UK government inform us that overseas development aid is being cut from a commitment of 0.7% of the GNI, and this has resulted in an estimated loss of £4.5 billion. The amount of money that represents and the work that it would be used for is just difficult to comprehend. This money affects essential work in health, education, social development and humanitarian aid, as well as other areas of development, and represents at least £48 million lost for health education alone. I mentioned that this affected our organisation. We had a project that was 4 months into a 12-month project that, alongside so many other project work, was abruptly cancelled in April 2021 with no further funding released to us. We estimated that up until that point, it had been 1,000 hours of volunteer work that had gone into that grant proposal, all of the grant requirements, and also the project itself. And as we are an association of anaesthetists, that was 1,000 hours of anaesthetists work between our UK and Zambian partners. Additionally, We had to invest more hours and more pounds, however, after this happened to us, to make sure that there wasn't regression in this essential project. And those hours and those pounds had to come from capacity from other areas of work that was just as essential.
So taking these as our 4 points forward, we looked at our approach to the advocacy during the pandemic and the things that we've done over the last, 12 to 18 months to help support programs and organizations. So one of the best things and one of the most exciting things we did from a fundraising point of view that brought everyone together, so looking at one team working together and developing partnerships and teamwork during the pandemic, was doing the London to Lusaka and then back again within a month. So we were 2 days short of months, so we managed to smash the goal very successfully, and we managed 34 countries and 23,566 kilometers. So that encouraged everyone to become active, which was really important during this time of lockdown and difficulties with the pandemic and how we were working. So from my point of view, it was a really great achievement and an amazing goal for all the people that were involved. And thank you to everyone that supported and funded us during this. It was a really impressive thing to do. So well done, everybody.
And then chronologically, I think the next thing that happened to us in our advocacy journey was that Zambia experienced a third wave of COVID-19 cases in June and July 2021. Sadly, this wave was much larger than the first and second, and sadly, many mortalities were seen. We worked as a partnership and as a charity to find ways that we could support our partners who were healthcare workers in Zambia, but also how we could advocate for a better global response, supporting Zambia through this crisis, but also more support for low and middle income countries in general to deal with issues like vaccine inequity. One of the things we did was we asked healthcare workers and community members, for example, teachers and pastors, to tell us about what the situation was happening in their hospitals, their facilities, and their communities. Some of the stories that we got back were really heartbreaking, but really helped us to understand and to communicate to others what the essential things were that we needed to be campaigning and advocating for. This is one of the messages that really has stayed in my heart for the last year. It's from a healthcare worker that has said, I've walked away from patients because I can't do anything. If there is a drug we need, it's oxygen. I would rather have no antibiotics, Clexane, dexamethasone, but have oxygen. And that really rings true to how essential oxygen is as a basic medicine. This is another one that really explains the situation on the ground, but talks about the demand for oxygen at the COVID centres failing. It just can't keep up, it says, and that the hospital is doing everything they can to try and mitigate this and to respond with increased cylinders, but there just aren't enough. And also mentions the importance of consumables and how these are also in critically short supply as well. This then led us to develop our Take a Deep Breath campaign, which had multiple aspects to it, partly relating to equipment, partly to training, and partly to advocacy. With regards to equipment, we were able to procure 52 oxygen concentrators that went to the COVID centres in Zambia, alongside multiple other essential equipment and consumables to care for patients with COVID-19. And this included pulse oximeters and devices for emergency airway management. This was a real achievement and hopefully helped to build capacity quickly. But also many of these devices, for example, the concentrators, have a very long lifespan and hopefully will help to build infrastructure in the years to come as well. We also, at the same time as this, wanted to communicate with the UK government how essential it was to increase support for overseas vaccination and to have the urgent reversal of the recent loss of significant UK aid funding. We wrote a letter to the UK government arguing for both of these, and we signed it ourselves as GADP, but also 12 other National and international anaesthetic organisations co-signed this with us, including the Association of Anaesthetists and the Royal College of Anaesthetists. The fact that 13 organisations signed this letter states and explains that we are all united in the fact that we understand and we feel strongly that we must, as high-income nations, support overseas vaccination, not only because of the need for equality, but also because that is the only way to manage a pandemic. And similarly, we must end the loss of UK aid funding. This has had detrimental effects to many development programmes, including in health and education, that without urgent reversal, we're going to see significant regression that will be very difficult to come back from.
So taking that forward and working together with organisations such as the Royal College of Anaesthetists, we've had a number of articles published in the International magazine, whether that be about our advocacy or about the remote fellowships or other areas of the programme. But we also, 5 of us, were involved in a podcast called Global Perspectives, the COVID-19 Response in Zambia. So that didn't just touch on the medical management and the way that patients were being looked after in Zambia, but it also looked at vaccine inequity and the equipment and kit that was still required within the country. And these give the opportunity for Zambians and for organisations to have a voice outside of other organisations and working together to ensure that we have an understanding of how difficult situations are in other countries. And you can find that online at the Royal College of Anaesthetists website.
We also went to a number of media outlets, both medical media, but also the public media as well. And we asked them to urgently help us communicate the situation in Zambia and why it was relevant that us in the UK and other nations understood what was happening in this third wave across sub-Saharan Africa and what our role and responsibility was in supporting those nations and ending this global pandemic. We worked most closely with Channel 4 News, and we were able to explain to them what we knew and we understood. We were able to share data, share stories, and they did a lot of research as well and collaborated with other organisations. And that led to this story, which was presented by Victoria MacDonald on the 6 p.m. evening news.
In normal times, they have 4, maybe 5 burials a day in this Lusaka cemetery. But Zambia is in the grip of the 3rd wave of COVID-19. Now they have 5 times that number, day after day.
We bury the doctors, we bury the nurses, we bury mother and father, we bury parents and child. So it's extraordinary how many people are dying, within a family. Someone dies, the day of the burial, someone else dies.
For a long time, it seemed as if they, like many other African countries, had escaped the ravages of the virus. But even if that were true then, it isn't now. Do you think that there are more deaths, for instance, than are being reported?
That is very possible because, as you know, that in our countries, we don't have enough capacity to test almost everyone who falls sick and also to test every death. Certainly, we did what we call a mortality surveillance, where we're swabbing cases that were brought in dead at the health facilities, and we found that quite a number of those were due to COVID-19.
This is a video put out by the Zambian Ministry of Health. Yet what we know from health worker testimonials is that the mortuaries are full, the hospitals are full, there isn't enough oxygen nor PPE, and only 10% of patients ever make it to a health facility in the first place.
One doctor services as many as over 9,000 people. That's the current ratio. And with COVID-19, it's now over a year and a half, and healthcare staff are overwhelmed.
There is an election in Zambia next month, and with it, accusations that the government is cracking down on people speaking out about the COVID response. But these are some of the messages we have received from healthcare workers.
We are losing doctors, and it's scary and painful. We are tired and speechless. Without the vaccines to reduce infection rates, or at least reduce the incidence of severe illness, we will be utterly overwhelmed by this and we will not win.
I've walked away from patients because I can't do anything. If there's a drug we need, it's oxygen.
These are indeed desperate times for a country like Zambia with an already struggling healthcare system. God help us.
They need vaccines here, as they do across Africa. And this week, a shipment arrived in Zambia, a donation by the United States, part of a 500 million doses pledge made at the recent G7 summit. The UK also promised 100 million doses, but the Foreign Office failed to answer repeated questions from Channel 4 News about whether any of them have been shipped.
Vaccines need to be in people's arms. So when you sit down around G7 and say we are going to give 1 billion and then we give them in a year, what about the people who die because they haven't had vaccine? Who takes responsibility for those deaths that will happen before the G7 sends its doses? It's not about doses, it's about timeliness. This is an emergency. And I think this is the message you must send, that a vaccine delayed is a vaccine denied. When you give it to me and I'm dead, it doesn't help me.
And now they are comparing COVID to HIV. A generation was lost then, and it's happening all over again with the ripple effects of so many deaths that will be felt for many years to come.
We also worked to develop a number of campaign videos. Now, we did this as volunteers and trustees of the charity and use these videos to help communicate these important points for advocacy and campaigning through social media, through other outlets as well. And a number of trustees and volunteers also wrote a number of pieces for within the medical media to help communicate this too. We've got a short section of one of our campaign videos as well.
When I first heard how bad the situation was in Zambia with rising COVID-19 cases, I think my main feelings were that of sadness and also a degree of helplessness. I was receiving messages from Zambian anaesthetists working in these really difficult circumstances with these absolutely heartbreaking stories of treating their own colleagues and sometimes losing colleagues, their own family members becoming unwell. And this was all during a period of time when basic resources like oxygen weren't always readily available.
I feel really angry that on the day that Parliament voted to cut the international aid budget, that I'm simultaneously getting messages from my friends in Zambia telling me about loved ones and family that are dying, completely avoidable deaths due to lack of oxygen and lack of investment in the health system. It's just so unfair. But at the same time, I feel quite hopeful and proud that despite the times that we're living in and despite those aid cuts, that we've managed to come together and raise already thousands of pounds to be able to procure oxygen concentrators to send to Zambia. And I feel happy that despite the fact I can't be there with my friends, rolling up my sleeves to help, that at least we can do something to support them from afar.
So we can see from those videos just how hard the last 18 months, 2 years have been. And what we need to do is ensure that we take this advocacy forwards and continue to be able to promote and advocate the issues that we're passionate about, whether they relate to anaesthesia in Zambia or safer surgery internationally. And I hope that through the methods that we're using at the moment, and hopefully going back to face-to-face training in country, we'll be able to produce more of the effect that we're having at the moment. And within that, we hope to be able to advocate individuals, to be able to align with organisations and get involved themselves in advocacy, whether that be with us or whether that be with other local or international organisations. And we're working towards trying to develop formal advocacy training within our organisations and looking to other organisations that are doing this and have been doing it for years. And through the press engagement, whether that be local or internationally. It ensures that we're educating and communicating these concerns in different ways. And we've managed to employ and use other people outside of anaesthetics in the medical world to ensure that we're doing this appropriately and maintaining those relationships. So thank you everyone from Sonia and I and from GADP for your involvement and for all the support that's been provided over the last 18 months. And we'll give you some time for questions. So I think Leslie's had to go, so it's down to Sonia and I to take our own questions, I think. So from my point of view, I want to say how difficult it was actually speaking after those videos, because when you're pre-recording a presentation and you listen to that, it does make you very sad. And I'm just glad that we can all come together in these types of events and be able to have these discussions. I'm just checking to see whether there's any questions.
Absolutely. I think so many of the videos are just, you can really feel the emotion in them. And we showed a little snippet of one of our campaign videos, but all of them are available on our YouTube channel. And they really do bring a tear to your eye, but also convey such important messages of how we need to go forward from here, supporting each other, ensuring equitable distribution of vaccines, ensuring we continue to advocate for international partnerships as a way to lead us out of this pandemic.
So I think, Sonia, we might have escaped without any questions.